Good afternoon, and thank you for joining us again today for the daily briefing here at St. Clair County EMA. You'll once again hear from Chairman Mark Kern, but first we're going to hear from Sam from the Health Department. Sam?
Yes. We have some new numbers today, and as they have done in the last couple days, our numbers have continued to go up. As of today, we are at 896 that have been tested, and as always, the numbers that we give you for St. Clair County are St. Clair County residents only that have been tested. We are at 193 positive test results, which is an increase of 14 since yesterday, and that includes 2 females in their 30s, a female in her 40s, 1 female in her 50s, 1 female in her 60s, 1 female in her 80s, and 1 female in her 90s. We have 1 male in his 20s, 2 males in their 50s, 1 male in their 60s, 2 males in their 70s, and 1 male in their 80s. We are at 663 negative test results, with 40 results still pending. And we do have some sad news to report today that we are now reporting 10 deaths, which is an increase of 1 since yesterday. And that was a male in his 70s who did have underlying health conditions. For state totals, we are at 105,768 that have been tested. We are at 22,025 positive test results, which is an increase of 1,173 since yesterday. And we are at 794 deaths, which is an increase of 74 since yesterday. And as always, our thoughts and prayers go out to families of loved ones who have lost those to this virus, as well as to the healthcare providers that have taken care of them. As a reminder, a couple days ago when Senator Belt was here, we will be having 3 new testing locations that are going to be coming very soon. Those locations will be 1 in West Belleville, 1 in Cahokia, and 1 in East St. Louis. And as soon as we have that information, we will be sure to put that out on one of the briefings that we do, as well as on the EMA page. And as a reminder, if you guys would like to look for any further information on coronavirus, you can always look at cdc.gov, as well as coronavirus.illinois.gov. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. Our condolences go out to the family of the new victim of this terrible virus. All 10 families that have been impacted by those 10 deaths. We certainly, our hearts definitely go out to you. These are difficult times. These are people who passed away and couldn't have family with them in the hospital. It's just a terrible time, and that's why we're doing this every day, to try to educate people to stop the spread of the virus, so that we don't have that we stop these deaths, that we stop this spread of COVID-19. Every day we talk about the zip codes and tell you new cases and the zip codes where cases exist. Remember, these are St. Clair County zip codes that have more than 5 COVID-19 diagnoses positive in those zip codes. So if you don't hear your zip code, it doesn't mean that there isn't someone in that zip code with the virus. It means that we don't have more than 5 in that zip code yet. And also remember, just because someone hails from the zip code where you might live, it doesn't mean that's where they contracted it from. So just use this information for what it is. It really isn't any guidance for you of where to go and not to go. It's just to tell you basically where the spread is in the county. In 62201, there remain 7 positive cases. In 62203, there are 7, and that is an increase of 1. In 62204, there are 6. In 62206, there are 16. That's an increase of 2 over yesterday. 62207, there are 9. That's an increase of 1 over yesterday. 62208, there are 15. That's an increase of 2 over yesterday. 62220, there are 10. That's an increase of 2 from yesterday. 62221 has 21. That's an increase of 2 COVID positive cases from yesterday. 62223, there are 15 cases. That remains the same. 62226, there are 30 cases. That is an increase of 3 over yesterday. And 62258, there remain 9. And 62269, we also are holding steady at 18 cases. So we continue to rise. There were 13 new cases yesterday. There were 14 today. We still see ourselves on the uptick with this virus, so let's remain vigilant. Also, remember, it's National Telecommunicators Week, so the telecommunicators remain a vital part and continue to be a vital part of the front line in the fight against this virus. So if you know a telecommunicator, you know family of a telecommunicator, be sure to give your thanks and praise for the great work they're doing. People that are also doing great work are those who are employed in our hospitals, and today from HSHS St. Elizabeth's Hospital is Lena Gorka. Lena Gorka is an RN, a residency coordinator and staff educator with St. Elizabeth's. Welcome.
Thank you so much for having me.
So Lena, you're gonna help us today to kind of, everybody's out in the grocery stores and elsewhere. If they have to be out, they're told to wear a mask. Can you perhaps give us some guidance on the proper way to wear a mask and to treat that mask?
Absolutely. So the CDC is recommending that when social distance of 6 feet or more can't be maintained, and that really does come into things like a grocery store or a pharmacy, public transportation, and those places that may be critical for our citizens to continue to go to, that you should wear a mask when you're in those situations. The masks are really designed as a method of source control by the CDC, and the recommendation is because people may be shedding the virus and still be asymptomatic. So asymptomatic or symptomatic, you should wear a mask, but absolutely, if you're symptomatic, limiting your exposure to the public and contact to only necessary things if you are thinking that you have the sniffles or something
so
like that.
So if you have symptoms, don't go out.
Yeah, absolutely.
Stay
I mean,
home.
you should, and limiting your exposure to your family too if you have symptoms as much as possible, kind of what we call isolating within your own home. You should still be trying to keep yourself safe and keeping your family members safe. So even if you're asymptomatic, you should wear a mask in public. Again, if you can't follow the 6 foot rule, or other people may not be able to maintain that 6 foot distance around you. And with the masks, some people and a lot of people are using a mask that's homemade. So I did bring one for an example. So this might be a mask, and there's lots of different designs out there. What we consider the outside of the mask would be the outside away from the wearer, and that side is considered dirty. So a couple of things is once you apply the mask to your face, you really want to do hand hygiene. So you'd want to gel with an alcohol-based hand sanitizer of 60% alcohol or greater, or perform general hand washing with soap and water. And then we want you to keep your mask on your face and left alone as much as possible. Anytime that you're touching what we call the outside of the mask, you're touching the dirty side, and that would be a requirement then for you to perform hand hygiene. So we ask that if you are in the public, if you are going grocery shopping, that you try to avoid utilizing your cell phone or other additional personal devices, which would require you to touch your mask. We also don't want to see the public wearing it under their nose. Your nasal cavity and your oral cavity are connected, so this doesn't protect the wearer from anything in the public and doesn't protect the public from you. Also, as a chin warmer or an earpiece. Either of these designs and configurations are not supported. You can, again, cross-contaminate, which would mean the dirty side of the mask could be touching your shoulder or your hair. And we are aware that this virus can be spread on the contactive surfaces. So once you've touched the outside of your mask, we also recommend that if possible, you don't throw it in your purse. You can fold it, what we call dirty side to dirty side. The inside stays out, and then we ask that you put it into a plastic bag or a paper sack, like a lunch sack. A lunch sack will allow it to dry if there's any moisture from your mouth on it. And then when you're ready to put it back on, just make sure that, again, put it on your face. Once you've finished adjusting it, perform hand hygiene.
So how often should you wash that, or if it's disposable, throw it away? Should it be after every wearing? Should it be Is there a time length? What is suggested?
That's a great question. I would say for a reusable mask, something that you've made at home, a fabric mask, should be washed in hot water with a detergent at least at the end of every day. If you know that you've been exposed to somebody directly coughing on you, or it's visibly soiled or wet, that would also be an indication that it would need to be cleaned. With a disposable mask, the same recommendation really applies. If it's wet, hard to breathe through, or visibly soiled, you should dispose of it and get a new one.
So when you talk about detergent, is it like Dawn dishwashing liquid, or are we talking about
Your laundry detergent.
laundry detergent?
Yeah, absolutely. Don't add any Dawn dish soap to your laundry machine. Just a regular laundry detergent.
But you wash this by hand. You don't put it in your washing machine, or do you? Or?
It's really depending on what the mask is designed of. A lot of people have used different things that I wouldn't recommend to put in your washing machine, depending on if you've used pipe cleaners or bread tie bags for the nose piece. So a gentle way to wash it would be by hand and allowing it to air dry.
Okay. Can you talk about gloves? So since we got the mask thing down, gloves are the next step.
Absolutely. So the CDC is actually not recommending that the public wear gloves. And the reason that they say that is because gloves can actually serve as a false sense of safety for many of the public. So what we really recommend with gloves is that if you can't remove it and take it off after you're done doing a task. So a task, for example, might be pumping gas. So gloves, if you put them on right before you pump gas, you use the machine, hang up the gas pump, and then remove your gloves and throw them away and get back in your car. That might be an appropriate reason to use gloves. But really, when you're wearing gloves and you're touching multiple surfaces, including the outside of your mask, the grocery cart, and anything else in the surrounding public, and then you touch your cell phone, you've contaminated that. The good way I like to think of it and explain it is that if you imagine touching raw chicken, a lot of people are worried about raw chicken touching other things. You would be really sure to wash that off before you touch something else. So the same with gloves. The germs are on the outside of the gloves. They should be cleaned and really disposed of, and your hands should be cleaned as soon as possible. So one of the best recommendations is just frequent and good hand hygiene and keeping your hands off of your face.
And when you go to the grocery store, use the disinfectant and clean the handle of that cart.
Absolutely. Cleaning all frequently touched surfaces is really a general best practice and good hygiene. And that might be surfaces in the public community, like touching the handle. Cleaning those surfaces and cleaning your hands and avoiding touching your face is always going to provide you a greater level of protection than wearing contaminated gloves and touching everything.
And you bring up the gas pump. That gas pumps carry a lot of germs. People don't necessarily think about that. That's great. That's great advice.
Yeah.
Do you have other advice for people who may be feeling that they're experiencing COVID-19 symptoms, what they should do?
Absolutely. If you are experiencing any symptoms that you think are related to COVID-19, we would recommend that you call your primary care provider. Primary care providers can save you an unnecessary trip to the emergency room where you may have a greater risk of exposure, and they can also make sure that the appropriate steps are put into place to protect the healthcare workers on the other side if you do need to go in. And what I mean by that is that the primary care provider can give everybody a heads up that somebody is coming in that may meet the criteria and have symptoms, so that appropriate precautions can be in place ahead of time for everyone involved. And for those people who don't have primary care providers, there are a lot of virtual care providers out there now. Right now, HSHS Anytime Care is one of them that you can download on your phone or go to online and be evaluated over the phone.
We sure appreciate you coming in. We appreciate everything that St. Elizabeth's Hospital is doing. You want to say hi to Grandma Gail?
Hi, Grandma. My grandma just got Facebook, so I'm pretty excited for her this week. But really, St. Elizabeth's Hospital just thanks the community. We have had such an outpouring of support from the community, from all the local citizens, and we really do appreciate them. We're blessed to be able to serve this community. They really are our passion and what drives us, and we look forward to continuing our care well beyond after this. And we're just really thankful for the Illinois Health Department and also for St. Clair County Emergency Management and you yourself, Chairman, for being able to continue to keep our citizens involved and engaged and informed, educated, and prepared to keep themselves and their families safe.
Well, we're blessed to have you working in the county, that's for sure. Herb Simmons?
Yes, a couple of questions, as always.
Yes, as
I can
always.
always think of something to ask these people who have so much knowledge. In your position as the coordinator, you're training these new recruits through orientation, am I right? Are you having any issues with them coming and saying, boy, what time did I pick to get into this profession?
I am really genuinely so proud of our colleagues to say that I have not had any of our new graduates or new graduate nurses who I coordinate their orientation period come to me and say that, what am I doing here? Nursing is such a calling, and especially within our ministry and organization, we find that we really attract people who are dedicated to this mission and our vision and our core values, and they are so happy to be here and be on the front lines. And in nursing school, maybe they didn't imagine that this is how they would be spending their first year as a nurse, but they are just rock stars and taking each day one at a time and looking forward to providing the highest quality and safest patient care that they can. I'm really truly proud of our new graduate nurses who have started in the midst of everything that's happening.
Okay, and if you had one last advice to give everybody, including Grandmother Gail, what would that be?
Just to stay home. If you can stay home, remain where you're at. I know it can be very difficult and given the holidays, but looking for other ways to connect, be it FaceTime or Facebook or any of the other social media platforms that are out there. If you can remain quarantined, isolated at home from the public, that's our best defense. So only going out if really truly necessary, and there's no other way to manage that.
Very good. Thank you. We appreciate it.
Thank you so much.
Thank you, Lena.
Thank you.
Well, once again, another fine presentation by someone who is on the front line working on this virus every day. I want to just give you a little update on the EMA side. The conference call every morning at 8 o'clock with the hospitals and EMS went well. More great information shared. We took order of some more PPE equipment today that we'll be getting it put out to our first responders and to those who need it. We had 16 departments already today pick up items that they needed. So we continue to try to meet their needs the best we can. We had a call the chairman did this morning with the state representatives that went well. I think we've got 2 more conference calls this afternoon still yet. But this is our 30th day, I think, of these briefings, and I want to thank each and every one of you that follow us. We try to answer all those questions. We see a lot of the regulars, and I really, truly appreciate the comments, and I know Chairman Kern does, and the entire staff here at EMA. We want you to share this. We want to get that word out there. You heard us say today, the best defense is to stay home. And that's what I tell you every day. It's real simple. Your chore is the simplest thing to do. And that's stay home and stay alive. And we'll see you back here tomorrow around 3:30 for the briefing. We'll be back in just a few moments with our ladies to translate this to our Spanish communities. Thank you very much.